Have you ever had that fiery, creepy feeling in your chest? You're not alone. In this video today, we'll discuss what exactly is heartburn. We'll discuss the causes of why you're having that burning in your chest. And at the very end of the video, I'll give you my natural ways to get your heartburn fixed from a GI expert. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm board certified gastrologist trained at the Mayo Clinic and CS Lubbock Gastro for all your GI and heartburn needs. And don't forget to subscribe to this channel. So what exactly is heartburn? Now, contrary to the name, heartburn actually has nothing to do with your heart. What happens is that acid goes from your stomach into your esophagus to cause that burning right here in the middle of your chest. That condition is called GERD, gastroesophageal reflux disease, and one of the symptoms of GERD is heartburn, that burning in your chest. Now, heartburn is not the only symptom from GERD. There are a lot of other symptoms you may be noticing in your body. One is that burning sensation, typically behind your chest. Number two is chest pain. In fact, this chest pain from heartburn can feel like you're actually having a heart attack. Now, the most important thing is when you're having chest pain, don't assume that it's heartburn. Always make sure you get your heart checked out because you cannot live without your heart. I can deal with your heartburn, but you need to make sure that your chest pain is not related to what's going on in your actual heart. Next is regurgitation, that delightful feeling of having that acid going up into your mouth and feeling that taste. You can also have chronic cough or asthma, which are extra GI symptoms of GERD as well, when that acid actually goes into your lungs to cause these symptoms to occur. Also, trouble swallowing, or the medical definition is dysphagia. This is when food actually slows down or gets stuck in the middle of your esophagus, where you have to beat yourself out to allow that food to come out. So what exactly causes heartburn? Now, like I mentioned before, it's actually not your heart. But the other thing you may not be aware of is that it's actually not an acid problem. So many people assume that when you have heartburn or GERD, the problem is too much acid. That actually is not the main reason why you have common symptoms of heartburn. The issue is your valve, what's called the lower esophageal sphincter. So normally at rest, whenever I'm sitting here chit-chatting, talking to you, not eating, that lower esophageal sphincter is closed. What happens is whenever you swallow or you drink something or you eat something, during that time, your sphincter actually opens up to allow food and water to pass through from your esophagus into your stomach. What happens when you have GERD or heartburn is that sphincters open longer and more often. So it's like having a door wide open and having all this content rush into your esophagus to cause the symptoms to occur. So the problem is a problem of the sphincter. So why is that sphincter open longer? There are a couple different reasons why. Number one is what's called a hiatal hernia. This is an anatomical defect in which the stomach goes above what's called the diaphragm. And so when your stomach goes above where it should be, that actually forces the valve to be open longer and more often. So when you have a hiatal hernia, that causes that sphincter to open up longer, and that causes more heartburn and reflux to occur. When you have a large meal, that space, that physical space of having all that food can cause your stomach to expand and also cause that sphincter to be open longer and more often. Certain foods can produce a lot of gas and also cause that sphincter to be open a lot more frequently. Have you ever noticed when you have spicy foods or fatty foods, that can cause you to have heartburn? The reason is because those foods produce a lot of gas, which opens up that sphincter. Gas only has one way to go, has to get burped up, and as it gets burped up, that can cause the sphincter to be open longer and cause acid to occur. Being overweight, the most common reason why people have acid reflux, that is because all that pressure on your abdomen causes that sphincter to be open longer and causes acid to go up into your esophagus to cause your symptoms. And then pregnancy. Yes, I've never been pregnant, but listen, literally every single person I know who has been pregnant suffers from acid reflux. It's the same concept. When you have all that pressure on your abdomen, it just forces that sphincter to be open, which causes your symptoms to occur. So here's the crucial part. Are you one of the millions of people who are suffering from acid reflux? There are a couple of natural things that you can do that I recommend to all my patients to get their reflux taken care of. Number one, chew gum. Surprisingly, there's actual evidence to suggest that chewing gum can actually help control acid reflux. That production of saliva can actually help neutralize the acid that is occurring inside your stomach. But not only that, the physical act of chewing gum can actually stimulate your stomach to contract things through the stomach into your small intestine, leaving less food in your stomach and more food to pass on through so you don't have such a large stomach. Number 2, aloe vera juice. This is a great soothing balm that you can drink to help coat the stomach to relieve symptoms of acid reflux. Even just a small amount can help ease the burn. Number 3, ginger tea. This tea can work wonders to help settle acid reflux symptoms. Just a small warm cup can help neutralize the acid to helpfully minimize the reflux symptoms that are occurring. Bananas, Mother Nature's natural antacid. Bananas are a low acid fruit that have been shown to help reduce the amount of acid that's being produced to helpfully minimize reflux and heartburn symptoms. This video is sponsored by Lubbock Gastroenterology. This is my GI clinic based in Lubbock, Texas. Our passion is to give our patients the best comprehensive care in this area. And we try to focus what we can to do things naturally, whether it's a functional medicine approach, a natural approach, or ways that we can tailor medicine to make you feel better. So if you want to see us at Lubbock Gastroenterology for all your GI needs, call this number or contact us through our website. We can schedule you today to get your GI tract back on track. Then lastly, lifestyle changes. Simple changes in how you eat can reduce your acid reflux symptoms. Elevating the head of the bed. Whenever you elevate that head, it can change the angle and it can allow acid not to go up into the esophagus, and you can use gravity to keep that acid down. Avoiding late night meals. If you can wait at least an hour to an hour and a half after your last meal, this will allow your food to digest so it doesn't go up into your esophagus. It can go into your small intestine and get away from the stomach. Sleeping on your left side. Sleeping on your left side can actually make it anatomically harder to prevent acid from going from your stomach into your esophagus. Now keep in mind, these are helpful tips, but if your acid reflux is still occurring despite these changes, or you have what are called the warning signs, including trouble swallowing, vomiting blood, black stools, anemia, make sure you see a GI doctor to find out exactly what is going on, because there may be something going on that's more than just GERD or acid reflux. Here's my call to action to you. If you're suffering from acid reflux or GERD, try these simple tips. They're effective, they work, they're backed by evidence, and if they don't work, come see somebody like me, which we can find out exactly the root cause why you're having your reflux symptoms. Here's my question of the day. Do you have any other natural options that you have tried to help control your acid reflux? Comment down below. I would love to hear what you guys have to say. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where we can take care of all your issues and get you all fixed up and feeling better. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.